Okay, that's lovely. Okay, right. I'm delighted to introduce to you this morning Jamie Mather, who is an ON, former Norwich School, of course. Jamie, I'm not going to try and give your job title because I'm not entirely sure I know what your job title is. Would you like to introduce yourself, please?
Yeah, well, thank you very much. You gave a very nice introduction. So my name's Jamie. I was at Norwich School between 2011 and 2013, so I was only here for sixth form, but had two brilliant, amazing years. And so now I sort of have two roles. I'm a staff nurse in A&E at the Norfolk of Norwich, so I'm going to tell you about that. And I'm also a medical student, so I'm training to be a doctor at UEA, which is literally right across the road from the NNN. So I'm going to try and give you some insight into both the role of a nurse and also the role of a trainee doctor, and the limited insight I have into the role of a working doctor as well. So I hope that's okay.
It is okay, presuming then that nursing came first for you.
It did. Yeah, that's absolutely right. And when you ask me about my journey since Norwich School, I'll try and give you a timeline and explain exactly where nursing fits in. Yeah, absolutely.
Yes, please. So from Norwich School sixth form,
Yeah.
what did you then do after you'd done, well, what A levels did you do, first of all, and what did you do after them?
Yeah, so I did my A2s were biology, chemistry, and maths. And I always, I at that time I wanted to be a doctor, and so I applied to medical school. I did my UK CAT. I went to interviews, and I got an offer from Aberdeen, University of Aberdeen. But then when it came to results day, I got A, and B. And that meant, oh, I know, heaven forbid, but that meant that my medical school wouldn't take me. So I was in the position of having had an offer, but they wouldn't take me on my grades. Now, that's not so much so now. Some places will take those grades. But that meant for me that I could either retake, but that limited my options as far as medical schools because some places don't take retakes, or I could go on and do something else and then use my degree as the entry requirements I'd need to get into a medical school. And that's exactly what I did.
So you can tell us about that now, sort of calmly and logically, and talk us through it. How did it feel on the day?
It was mixed feelings. I was very much briefed that it was not likely that I would get AAA, which is what I needed, but I would be predicted it on the to give me the opportunity. And all of the heads of department, the heads of biology, chemistry, maths, had those quite difficult conversations with me. Okay. So I wasn't expecting a fanfare and drama all to be perfect. So I went in with some hastency, but I was really pleased with the results I got. And I think there's something to say is that in the grand scheme of things, although you might not be, you might not have got the UMS, or you might not have got full marks there, or you might not have got an A star, you would have had really good results and you would have worked hard for them. But in that moment, it is really disheartening, and you can't see further than what you're doing at the time, doing your A levels, and you just think, oh my God, I have no future, it's all gone. But hopefully, if I'm something to say, that it isn't always like that, and there are more circuitous and scenic paths, but still with the end objective.
Okay, so once you got your results and you knew what your alternatives were, what then?
Yeah, so I think there's worth just saying at this point, there's three sort of different outcomes you can have from if you're being a medic. So number one, you can have an offer, get your grades and go. Two, you can have your offer but not get your grades. And therefore you're going to have a year out as a minimum, or you can make your grade but not have an offer, which means you're going to have at least a year out as a minimum. So that's just the three things. So I was in the situation of having had an offer, but I didn't make my grades. So then I had the option of one, reapplying, or two, doing something else, reapplying and retaking my A levels, or doing something at B, doing something else first. And so I chose the second. So that was my kind of thinking. So I had a year out. I worked at Norwich School for a bit. So I don't think any of the current pupils will remember me, but I worked in the biology labs. I also worked as a healthcare assistant, or sometimes called an auxiliary nurse or a nursing assistant at the NNN. So I already had my foot in the door healthcare wise.
What does an auxiliary nurse do, Jamie?
Yeah, so they are on the ward all of the time, looking after the patient in conjunction with the nurse. So quite a lot of their duties are domestic, so helping the patients with the things that they are otherwise able to do. So cleaning, or washing themselves, going to the loo, checking the patient's observations, their blood pressure, their temperature, attending to any wounds or dressings they have, checking their blood sugars if they're diabetic. So it may not seem very glamorous, but it's really, really important foundations of.
Absolutely, it's essential skills. Yeah.
Which doctors have to learn. I have to learn all the same skills that an HCA has to do in medical school. Nurses the same. So it was a really good foundation. And one of the questions that I think you might ask me later is about work experience. And that is an absolute recommendation I have to anybody that wants to be a doctor, a nurse, a paramedic, a pharmacist. Go and be an HCA in your summer breaks or in your holidays or whatever. It's really, really powerful, useful stuff.
Yeah, absolutely. Okay, so you had your year.
Yeah.
Then what?
So in my year, I didn't reapply for medicine because I didn't have the grade. So I applied to be a nurse. And what I was lucky for is that the entry requirements for nursing are slightly lower. So I effectively had my pick of any nursing school. I wasn't inhibited by the grades, let's just say. I still had to apply and go for an interview, but I could pick anywhere. So I picked some what I thought were quite high-flying places. So Nottingham, do a 4-year master's in nursing, which I picked. King's College London, which is Florence Nightingale's School of Nursing, so her own nursing school, which has evolved through the ages. I picked Southampton, which is a very prestigious nursing school, and I can't remember where else I picked. No, it's completely gone. But anyway, some quite high-flying places, and I ended up picking to go to King's College in London. Because it's a very prestigious and it's a long old institution, and B, because I wanted to be in London where the brilliant, excellent hospitals are. So that's where I ended up picking to go. And so that whole year was going to interviews, getting ready to go, and then in September of 2014 I went.
Okay.
Yeah.
Wow. So 4 years, 3 years?
So nursing's 3 years. Yeah. It's 50% theory, 50% practice. So there's a set number of hours. You have to do 2,350 hours of theory, 2,350 hours of practice to complete your nursing degree. So yeah, it's hardcore.
Yeah. And what's the best bit? What's the worst bit of the training?
The worst bit, and this actually is probably the same for medicine, is your time is being pulled in so many different directions. So you're having to be working full time, 37.5 hours a week, 3 long 12-hour shifts. But then you're writing your dissertation or you're writing your assignment in your evenings and your days off. And that is exhausting because you're effectively living 2 lives at once.
Yeah.
And that's luckily only so when you're training in your profession, but it is really, really exhausting.
Yeah, very intense. Yeah.
Or the best bit, I think, is always the team of people you're around, and they carry you through, and the camaraderie is absolutely brilliant. And so, of course, it's a wonderful, noble thing to be looking after our patients too, but the team make it for me. So absolutely. My student nursing colleagues, my fellow medical students, and the people I work with are just top-notch brilliant. And they make coming into work every day such a treat.
Fabulous. Fabulous. Can't say fairer than that. Okay. So from King's College to what you're doing now, I mean, there's a gap of some years, obviously, but how come I'm talking to you in as somebody doing 2 roles?
Yeah. So I've already told you that I applied to study medicine when I was 18. And so that thought was always in my mind when I was doing nursing. I went into it with an open mind, thinking this may be my profession forever. Also, I could still go on and be a doctor. So I genuinely was open-minded. And there were highs and lows where I thought, yeah, I want to be a nurse forever. Sometimes I thought I really want to know more, or I see a really inspiring doctor and I think I want to be like them. So there were moments of both. So I worked for a year full-time in A&E after I qualified. And during that time, I decided, yeah, I want to be a doctor again. Okay. So, and then I went through exactly the same application process as I did when I was 18, and I had some really fantastic support from Mr. Croston and Mr. Hooper at Norwich School, who helped me reapply again in exchange for visiting regularly, as I would do, and encourage people to be doctors and nurses and such like. So yeah, I had to reapply, and I went through exactly the same process as I did when I was 18. I had to write personal statement, do my UK CAT, pick my medical schools and go off for interviews, etc. So there are a number of reasons why, and I think every medic should ask themselves the question, why not be a nurse? It's absolutely fine if you have a justified reason. What's not fine is if you've never considered it. And I think that's the thing you should think about, because there are some incredibly high-flying and prestigious nurses in the UK that work in very finite particular areas. There's nothing now that a doctor does that a nurse doesn't. There are nurses that do surgery, there are nurse consultants, there are nurses running hospitals. And so I think you really need to delve into the role of both a nurse and a doctor, understand the similarities and understand the differences. And you need to be able to justify, and it is a common interview question, why are you not applying for nursing? So have a think about that, because that's a really good point. And if you
really useful, yeah.
If you want any more insight, hopefully you'll gain some through this video, but if you want any more insight into the role of a nurse, or I can point you in the direction of paramedics and pharmacists I know who are ONs, please do ask, because I'd be really delighted to tell you.
Okay, so you're still on the journey of qualifying as a doctor.
Yeah.
When is your qualification date in theory?
So it's due to be July 2023.
Right.
However, just to add a spoke in the works, the people that are applying to medical school may already know about this, but you have the option in a medical degree, which is normally 5 years if you go straight from school, and I'm on a 5-year course. You can do an extra year where you drop out of the medical school teaching and you do another degree related to medicine. It's called intercalating. So some of your applicants that are interested in medicine will probably know about this already, but I'm considering doing an intercalated degree. And I want to do a master's degree, ironically going back to London, not to King's College, but to another university. So I'm currently weighing up whether I do that or not. And what that would be, it would be delaying my medicine completion by a year, because I'd step off the medicine programme for a year.
Okay, and you'd step off to study, what are you thinking, Jamie?
I'm wanting to study critical care, which is a branch of medicine which incorporates emergency and intensive care together, which is what I want to end up doing. And
that relates back, I suppose, to your year in A&E, where you thought, actually, yes, this is for me. Yeah.
Exactly. Yeah, 100%.
So the experience is everything.
Yeah, and I think you might ask me later about experience, but I'll say about it now that work experience for medical students is as much about proving that you are a good match with the profession, that as the profession is a good match for you. Medicine is hard work, and I think everybody needs to use work experience as an insight and a taster into what being a doctor is like, and make sure you really, really want to do it, and it is 100% what you expect. So yeah, you're absolutely right. Experience is really everything, and will inform, the placements you have, the teachers you have, the experiences you have will inform your avenues and how you explore, your future career opportunities.
Okay, good. Thank you, Jamie. So talk us through a typical day. What does your day at work look like? Is there such a thing?
Well, there are some things which you can hang on to as being relatively normal. So one, let me tell you about a nursing typical day. So nurses work 12.5-hour shifts. So we do 7 till 7.
12.5 hours?
Unless you work in niche areas such as outpatient clinics, but most of nurses work 12-hour shifts. Okay, so it starts at 7 a.m, finishes at 7:30 p.m, and then a night shift is 7 p.m. to 7:30 a.m. So there's a half-hour cross between the two shifts as we hand over at morning and night. So that's the way our shifts work. So normally we'll come in, depending on whether you work in a ward or we work in an emergency area in A&E, or whether you work in theatres, you'll have a briefing or a handover, or you'll exchange information about patients during that time. And then you will normally go and do safety checks in your area, make sure your area is ready to go. Most areas will have patients in already. It's very rare, unless you work in theatres, for example, for you to have no patients when you come onto your shift. And then we'll go around, introduce ourselves, and then normally hit with a list of jobs and the things that need to be done: medications, treatments, referrals, paperwork, discharges, the works. And we'll work through that during the day. If you're on the ward, it's a bit more structured. You have fixed meal times, you have fixed times medicines are due. In A&E, there's nothing fixed. It can be whenever or wherever, which is part of the reason why I love it. And then, we have sort of 3 breaks to the day. We have a morning break, a lunch break, and an afternoon break, and they add up to about sort of 45 minutes in total. And then obviously you hand over at the end of your shift and you go home. So that's a nursing day. A medical student day, we at UEA have different days depending on what day of the week it is, different functional days. So we have 2 days of lectures, or 3 days of lectures. We have a day of anatomy where we do dissections. in Wednesday morning, and then we have a Wednesday afternoon. We have a GP day where we study with a GP tutor somewhere in Norfolk, and whatever topic we're doing that week, we are exploring, and the GP tutor brings in patients that have that condition to teach us. And then, 3 days of lectures. And then we have PBL as well at UEA, which is small group working, which we do on Wednesday morning. Yeah.
Okay. I'm exhausted even hearing about that, Jamie. Which at the moment, do you love them both, or is there one role that you favour over another, or?
Well, what I really like is I really like learning. I absolutely love learning new things and working out why things work and understanding things. And so actually I learn that in both different roles. In nursing, you're much more learning on the job. And that's why it's the 50% of the course is theory. In medicine, I think the attitude, and it's quite a traditional attitude, is that you learn the theory first, you learn from the textbooks, you read the manual, you read the instructions, and then you go out and practice, which I find as somebody that's been practicing as a nurse quite inhibitory. But
Yes.
I think for a lot of people, it feels quite safe that you learn the theory and you have some understanding before you then go out into practice. And so that's useful for a lot of people. And the way our placements in medical school work is that we learn the theory first, and then we go into hospitals for sort of 4 to 6 weeks, and we learn the practical things that are going on there. So we have the theory kind of preloaded in our head. Yeah.
Okay. And you mentioned there the nursing, the shift work. How did you how did you adapt to shift work? Do you get a week on, a week off? I mean, how does it work?
Yeah, so fantastic question. So nursing, we work 13 shifts in a 4-week period, which means you work 3 weeks of 3 shifts, 1 week of 4 shifts. That adds up to 13, and that's the equivalent of full time. So that's 37.5 hours, and we work it pretty much randomly, if I'm honest. So there's somebody, our manager in our office allocates our shift, and they have to look at the skill mix of people that are on senior, junior. Can this person do X, Y, and Z skills? Can they manage the department? And so it is quite random. So we can, and in A&E especially, there's the same number of staff 24/7, day and night, because we don't ever close. So half our shifts are nights. 2 out of 7 of our shifts are weekends, the same proportion as there are weekends. We do tend to do our nights together though, so we tend to do 3 nights on the trot, bink, 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 just because you're into the swing of things, which is actually quite a good way to do it. But adapting to night shifts, no matter what healthcare profession you work in, you will have to do. And it does take an art, and everybody finds a different way of doing it. I have to have strategically placed coffees to keep me awake. So one before I start, one in the middle of the night. But generally, there's enough to keep you going and keep you busy that you don't feel too sleepy. But yeah, you have to then make sure you've got a good environment at home. You've got good sleep hygiene and routine and blackout curtains so you can sleep. Okay. So it is a challenge, and it does take some getting used to. Yeah. If you do something like an HCA or whatever, you can test the water and do night shifts as an HCA. So you get the idea of what it's like to be working in the night, in the evening, and all times of day.
Yeah. So there's a real sense of lifestyle and personal management there that you've got to commit and go with it. And yeah. Okay.
And you thinking about how you time your life and how you build in a work-life balance, it's all about planning. And as much as you have your shift in your diary, you need to plan some you time in your diary and have it in there and stick to it. And that's the only way I can do it, because if you just hope you'll find a moment here and there, it doesn't happen. Something will get in the way and get busy. So you have to book in to have some you time. And my best friend at medical school, bless her, has forced me, because I'm appalling at this, and she'd be laughing because I'm such a hypocrite, has forced me that I have to have 1 day a week off where I'm not a medical student or a nurse and I do nothing medical at all. And it is the most refreshing day of the week.
What do you do, Jamie? What do you do when you're not being medical, Jamie?
At the moment, there's not much to do, is there? I work my way through Netflix. I'm reading Roger Moore's autobiography, which is a book I'm reading at the moment, which I love. But just chilling, going for walks with my friends and things like that. And it just does the world of good, because I feel a huge amount of guilt when I'm not doing university work or working with my colleagues, that I should be doing something useful with my time. And a lot of colleagues feel similar. Oh, I should be preparing for that test. Oh, I should be revising. Oh, I should be helping my colleagues who are, overworked and underpaid at work. And actually having that 1 day week off, that guilt goes, and it is so refreshing. And
It's
so
interesting that you talk about that. Is that an innate sense of duty and vocation, I suppose, that there's so much to do? So
I think your students will have it too. Working towards A levels and exams, etc. You feel like you must use every hour and use it productively for working. And actually, you're not always that productive if you're expending yourself and working yourself to the bone every hour. So having maybe that 1 day off a week where you are not an A level student and you just forget all about it and do something you enjoy. I mean, I 100% recommend it. I love it to bits.
what's the best bit about your job or jobs?
I kind of already alluded to it, the team. I love the people I work with so much. They are a work family. I have a work mother, I have a work wife, and I adore coming into work every day and working with them because we're such a resilient, hardworking team that look after each other, and we have nights out outside of work, and it is just fantastic. They're such a brilliant group of people.
Makes all the difference, doesn't it?
100%. And of course, looking after our patients it's so rewarding that patients will entrust you literally with their lives and with information that they will not tell their nearest and dearest or anybody. It's a real privilege to be, although only a tiny snapshot in that person's life, such an important person in it. So that is a real treat as well. And when I have not been at work for a while, I forget that, I remember that because I'm not doing it every day. And then when I come back to work, it's also more rewarding because it really makes you feel like you're making a difference. So that is brilliant, although really cliched, I know.
No, cliches are there for a reason. It's lovely. And the worst bit?
The worst bit is when you haven't got enough time in the day, be it university work time, be it work time working A&E, to do a good job. And it's a real difficult thing. By definition, medics, and I'm sure some of the people that will be watching this thinking about it, are perfectionists. And while being a perfectionist and striving for the best is fantastic, and I am guilty of this myself, unfortunately, the NHS and the amount of time and the volume of work in medicine and nursing, there isn't enough time to do a perfect job all of the time. And you can be left feeling that sense of guilt, and that you've done a disjustice to your patient, or you've not put enough work into X project, you've not prepared well enough for Y exam or whatever. And so that is difficult because you do feel like you've not done a good enough job. But I think that's something you have to learn to live with. That patients won't necessarily know you've not done that gold star plus job. They will be grateful for what you have done and the fact you've stopped and listened or whatever. Yeah. So that is the hardest bit. And it's something I am still very finding my feet with and junior in doing. But I think I've at least realized that you cannot do a perfect textbook job all of the time, be it in your commitment to university work or your actual working on the wards or whatever.
Okay, I can't sort of go on, I suppose, really, without asking about the effect of COVID-19 on your jobs, on your roles. I mean, is the backlash coming, or is it hard now, or how do you feel about things?
Well, I am in a sort of unique position in that I am jumping quite regularly between the two. So don't get me wrong, I'm not working full time in A&E, but also I'm doing uni most of the time, but I am popping into A&E and doing the odd shift, etc. So yes, COVID has been really difficult. It's meant every single practice, every single process and system we have in the hospital has had to change. And you had to come into work being so open-minded as to not knowing what your day was going to look like, not knowing where you'd be working, not knowing who you'd be working with, not knowing what PPE you would have. It was really challenging, and I just had to keep teaching myself to be open-minded and not go in with any preconceptions. The volume of patients and stuff that we've come through is a lot busier in some areas and a lot quieter in other areas. So it has been a mix. We've been seeing much less children come through the department, but lots and lots of adults coming through, and lots of sick adults with COVID, or because they've got other things like heart attacks and strokes, but they're staying at home a long time because they're worried about coming in and catching COVID. So it has had a significant effect, of course, and it will have a significant effect for years to come on the health system, which is why, leading on to my point about what life is like as a medical student, medical students really need to look after themselves, because we've moved our learning, as I'm sure you guys have, entirely online. We do still go to our GP tutor 1 day a fortnight to do in-person learning, but that's it. Everything else is Zoom lectures or self-directed study or Zoom group learning and stuff. and that just takes so much longer and is so clunky, and the hours lecture that we'd get in person, I'd come away feeling I grasped a topic. An hour's Zoom lecture, you don't get as much content in because it's clunky and difficult, and therefore I go away and have to read up and watch YouTube videos about X, Y, and Z for 2 and 3 hours to actually get a grasp as to what the topic is about. So everything takes longer. So yeah, it's a really different way of learning. If I'm brutally honest, I hate it. I absolutely love in-person learning, and it's reminded me how brilliant lectures are and how much I love going to them. But yeah, it has been a challenge to adapt. But we're kind of getting used to it, I guess, as everybody is now, and people are getting more used to it and more savvy with Zoom and et cetera, et cetera.
Okay, so for our young people now who are thinking of pursuing medicine in whatever form as a career, we've touched a little bit on the soft skills that you might want. So resilience and flexibility, empathy, reaching out to patients all the time. And what I've completely lost my train of thought. I was going to ask, what are the hard skills that young people can try and acquire before application or during work experience? Is there anything they can be doing to sort of prepare themselves to make a compelling, strong application for medicine? Yeah,
good question. I suppose this also links with work experience, so I'll try and talk about both those.
Yeah.
So ultimately, you need a medical knowledge, don't you? Absolutely. I'm a passionate believer that the soft communication skills are the big winners in medicine. You do need a medical knowledge, and you need a systematic, logical way of thinking to work through a medical problem. Now, medical school and nursing school, what they do is they teach you the knowledge you need to do your job. They teach you the scientific, the pathophysiology, the way the body works. What can people do in advance? I think is you can think about learning about things like clinical reasoning and clinical decision making, which every health profession has to do, and that's the foundations of what we do. And there are lots of fantastic YouTube videos or e-learning packages on that. Do I think it's vital? No, because you will learn it in uni. Thinking about work experience, there are two kind of categories in my mind. I think about it. There are things you can do which will actively give you skills to prepare you to be a good doctor or a nurse or a paramedic, and there are things that you can do which you can relate the skills you've done to the role of a doctor or a nurse or a paramedic when you're thinking about your application. I've made a few notes on this, so just let me find them. So because I don't want to tell you the wrong thing. So yeah, so let me think about the things that are good to do, which you may not necessarily think directly relate to being a doctor or a nurse, are things like working in nurseries or schools or special needs day centres, or having a part-time job or charity work. It may not have a direct health medical link, and that's fine, but it does give you crucial skills in dealing with people and negotiating, communicating, making shared decisions, helping people, which ultimately are the soft skills in other professions, but I would argue are pretty intense and important skills in medicine. So think about those. And actually, it doesn't necessarily matter so much what you do. And writing your personal statement, it is definitely not a tick list of I've worked in a care home, I've shadowed a GP, I've worked in a hospital. They don't mind what you've done. What they're interested in is how you relate that to the role of a doctor. So you need to show your insight into the role of a doctor or a nurse, and also what you've done already to bridge that gap, how you can relate to that. And it can be through a very diverse range of things. Okay. Second, there are some things you can do, and it's a little bit of I'm going to try and sell you some ideas because the things I'm involved in, which may give you some real hardcore, tangible medical skills that are useful. So since I've been 10 years old, I volunteered for St. John Ambulance, which is a national first aid charity. And so at the moment, we've been commissioned by the NHS to provide volunteer vaccinators to the NHS vaccination programs across the country. So unfortunately, you have to be over 18 and have the equivalent of 2 A levels to be a vaccinator. But we're also recruiting people from 16 years old to work in our vaccination centres, looking after the vaccinees, if that's the right word, the citizens that are coming for their vaccinations, and running, fetching, carrying, etc. And so I really recommend that if you have people that are thinking of doing medicine, that they could sign up to this. It's obviously in Norwich, so if they still have, we had a community service afternoon. I'm not sure if that still exists at Norwich School.
Yeah.
But you could wander across to the Castle Mall where the vaccination centre is on your community service afternoon and go and volunteer. So I'll send you some information about that.
Fantastic.
The Cross, again, a national first aid humanitarian charity, has programs for 15 to 17-year-olds as well. And then, of course, there are the more traditional things of doing work experience in a GP surgery or in a hospital. One thing I'd recommend that not a lot of people think about as work experience is just spending an hour doing what we're doing, interviewing a doctor or a nurse or a paramedic or whatever, and finding out about their role, asking some probing questions, A, that you want to know, and B, that you think will give you insight into the role of that profession. And
how
so,
can we know until we ask?
Exactly. So if you have anybody that would like to do that and ask me questions, or ask any of my medical student colleagues, or I have qualified doctors that I know that will happily answer your questions, or nurses of all stages of their training that will happily answer questions, please get in touch, because I can definitely point you in the right direction.
Fantastic, Jamie. Thank you very much. Can I get to a nitty-gritty question?
Yeah,
what sort of money do you expect to earn in medicine, as a nurse, as a doctor?
Good question. So I had to do a little bit of research on this, so I got the facts right. So in nursing, the pay scales are very, very transparent, which is very good from a gender equalities perspective. Our pay is banded, so there are different scales on the ladder, and then within these big scales, there are different points that you move through. So every nurse will start at what's called band 5. So that's the entry level band. That is a graduate professional that works in the NHS. So a paramedic, a pharmacist, a midwife, a nurse, a radiographer, all of those will start at band 5. And the starting salary, so your starting salary for that before tax, is £24,907. And that is, from my research, above the national graduate starting salary. So it is good. The NHS look after you. Don't get me wrong, it's not the best. You're not going to earn as much as a banker, but you also get decent holiday. You get 5-6 weeks of holiday a year. You get pretty much the best sick pay regime in the country. You get a very good pension. If you're not able to come into work, so my colleagues, etc., who are having to shield at the moment, they're obviously still on full pay, via the NHS. So although it may not be the best paid employer during the good times, if you are sick, if you need to take time off work for whatever reason, they are a good, because of COVID, they are a good employer from
the whole lifestyle package is really
exactly.
Not just that figure that goes into your bank each month.
For sure. And there is obviously the opportunity to work bank and overtime in the NHS. The NHS really needs workers at the moment. So just to add, as you become more senior, every year you'll get a slightly increased salary. So if you're still working at band 5, that entry level, at 7 years after you've been working, your salary goes up to about £30,600. And then if you move into more specific roles of nursing, such as management, being a ward sister or a charge nurse or a specialist nurse or a nurse practitioner, you can earn up to 109,000, which is the top of band 9, which is the top rung on the ladder, and maybe a director of nursing, so a senior nurse in management or a very specialist nurse consultant could be earning that. And that's the equivalent as the top pay scale as a medical consultant. So thinking now about medicine, which is what you also asked me, these numbers are quite fixed. They were less so in the past, but now they are. So FY1, which is the first year after you graduate from medical school, their starting salary is £28,243. So it's only about £4,000 more than a nurse. So actually, maybe at those early stages, there's not too much of a pay disparity. When you move into an F2, so that's 2 years after being qualified as a doctor, your salary goes up to 32,600 and something pounds. So then you are starting to extend beyond that nurse's salary. And then as you move through, I won't go through all the figures, but as you move specialty training, where you're choosing what sort of doctor you want to be, your pay ranges from about sort of 35 to about 60,000 as you move through and become more experienced. And then when you're a consultant, your NHS pay is between 75 and about 105,000, depending on your seniority and how much and where you work.
Okay. Wow. Comprehensive answer, Jamie. Thank you very much. Now, I'm conscious we've talked far longer than I thought we might, but it's been so interesting to listen to you. I suppose I'm going to wrap up with a couple of easy questions. If you could do anything differently, if you could go back and talk to your 18-year-old self, is there anything you'd do differently?
What a fantastic question. I've often thought about this. So no, I always wanted to be a doctor. So let's make that clear. I'm never going to deny that. But I'm really pleased that I got an insight into the wider health system and different health professions first. And so, yes, I went to medical school aged 23, 24. And so I wasn't a spring chicken like the 18-year-olds that were also on my course, but I was really grateful, A, for the life experience I had, B, for the professional working knowledge of healthcare and medical related things, and C, because I can still work as a nurse, and I've had so many opportunities open up that I can partake as in my medical training and as a nurse, because I had a career beforehand.
Mm-hmm.
And so no, I wouldn't change anything. Maybe I had a year out before I went to nursing school, and I had a year out between nursing school and medical school. Maybe I would think about whether I did both of those. I could have chivied things along a bit more, but ultimately I'm really happy with the way things worked out. And I hope that may be a lesson to people that receiving their grades in August, that it is okay if your grades aren't what you expected. I would never use the word failure, but it's okay that things don't go to plan. And things will not go to plan all the way through your life. So it's a good life lesson, albeit a hard one. Mm-hmm. And see it as an opportunity for alternate pathways. You're still going to get to the same place, but slightly non-traditional alternate pathways to get to where you want to go. See that as a fantastic opportunity and not as sort of sloppy seconds option.
Absolutely. Yeah. Fantastic advice. Where do you see yourself in 10 years' time, Jamie? You must think about that.
It's well worth saying that medical training is long, so I can't quite work out where it'd be. I'd like to train as a doctor that works in A&E and intensive care together. I also do have a passion for looking after children as well, so whether I can integrate that into my role as well. So I think I'll probably still be in sort of specialty training, hopefully still living in the UK. The NHS has given me an awful lot, financially and in education and support. So I'd like to definitely give back many years of service to the NHS. I'm not quite sure whereabouts in the country though, so we'll wait and see.
Exciting. I look forward to watching you and seeing where you end up, Jamie. You'll keep in touch, won't you?
Of course.
Final question before I stop recording. Have you got any quotes or mottos or words of wisdom to lend us?
I have, and this is the thing I've prepared the most. So I've got 3 pieces of advice. 1, read this book here. It's called Bounce by Matthew Said, and it's all about purposeful practice and about making the most of the limited time you have to meaningfully pursue things and achieving excellence. So it is a little bit of a self-help book, but it's not that bad. So yeah, it's called
excellent recommendation.
Yeah. Well, from all good bookshops. Number 2, and I've just got to get this up on my phone. Please watch this video. I don't know if you can see that.
Adam Kay, The Funny Side of Medicine.
Funny Side of Medicine. Anybody that is applying to medicine, you need to watch it, because Adam gives a really rational, balanced, informed insight into what it's like being a doctor. Okay. So please watch it. It's 45 minutes of your time and it's worthwhile.
Well worth it. Yeah. I agree.
My final thing is just a sort of my perspective on medicine and healthcare, which is to say that it is a beautiful, honourable, fantastic profession where you do get to help really sick people when they're feeling extremely vulnerable, but you are committing to a minimum of 10 years, maximum of 20 years of training and assessments and evaluations and examinations and doing work alongside learning and night shifts and missing birthdays and Christmases. And so it is an immense mental and physical toll, and you often feel like you can't escape the medical world even when you're not in medicine. So it is a huge burden. And Adam Kay's book is called This Is Going to Hurt, and it's called that for a reason, is because medicine does physically take its toll. And so I implore your people out there, your students, to make sure they really want to do medicine for the right reasons and they really understand what medicine is. So it's not about having a nice golden plaque on your door that says Dr. Blah de blah and lots of letters after your name. It's not just a traditional success route into a profession, but you should do it because you want to serve humanity and you want to do some good. And you do that through about 10% science and 90% by listening and empathizing and communicating and making shared decisions and respecting your patients. So I absolutely implore everybody that wants to be a doctor to do it, but go into it with an informed opinion, understanding what it involves.
I can't say fairer than that. Jamie, I can only thank you for your extended time this morning. I wasn't expecting to chat quite so long, but my goodness, it's been so interesting. Your candor and your honesty is, and your enthusiasm actually, is so refreshing. And I think a lot of our budding medical students and their families will really benefit from this. So thank you so much. I'm going to stop recording now.
Can I just say before I go, if anybody wants to contact me, I'm going to give you my email address.
Super, and I can make sure I pop it out as well.
Exactly. I will Zoom or FaceTime, Teams, answer any questions. I'm more than happy to.
We're so grateful. So on behalf of the Norwich School community, Jamie, thank you very much.
Bless you. Take care.
Bye-bye.